In this video, we will explore OET reading part B. Let's be very clear today. If you are getting 3 or 4 wrong in reading part B, it's not because you can't understand English. It's because you are reading everything as equally important. OET does not do that. Yes, healthcare professionals, they don't do that. Today's video is not about tips. It is exam level clinical reading training. So stay till the end because what I'll show you today changes how you read every single part B questions. Got it? So reading part B tests clinical priority filtering. Can you instantly recognize what information is critical, supporting, or background? Most candidates fail here because they choose interesting information, detailed information, educational information. But remember, what OET wants is information that directly guides action. Let's prove this using an example. So, here is the text: medication administration, oral anticoagulants. Patients prescribed oral anticoagulants require careful monitoring due to an increased risk of bleeding. Medication should be administered at the same time each day. Patients should be advised to report any signs of unusual bruising, prolonged bleeding, blood in urine or stools, or persistent headaches. Staff must check for potential drug interactions before administering anticoagulants. Caution is advised when patients are prescribed antibiotics or non-steroidal anti-inflammatory drugs. In the event of missed doses, patients should be instructed not to double the next dose and to seek medical advice. So if you want, you can just pause the video, you can read it by yourself and understand. Then we will move on to the question. Now, the question here is, what advice is most important for patients who miss a dose of oral anticoagulants? And here are the options. They should monitor themselves for headaches and bruising. They should take the missed dose as soon as possible. They should avoid doubling the next dose and seek medical advice. They should ensure the medication is taken at the same time daily. Now, let's apply clinical priority filtering. If you see option A, that is mentioned in the text, right? General safety advice not related to missed dose, supporting information. Got it? And if you see the option B, it is not sounding logical and there is no common real world assumption and it is nowhere stated in the text. Dangerous assumption. That means that equals to automatic elimination. And option C, this one directly address the missed dose. Safety is focused here. It prevents overdose risk. So this means critical information, which is the correct answer for this question. Okay. And let me tell you option D also. Option D is true, but it is not the routine instruction, okay, and not relevant to the problem scenario. It's just a background information. Got it? So option C is a correct answer. So remember, in part B, when it comes to questions, they are not asking what is true. They are asking what matters most in that situation. Got it? So remember in that way. And let's move on to the next text. So this one is managing patients with dementia. Patients living with dementia may experience confusion, agitation, and difficulty understanding instructions. Staff are encouraged to use clear, simple language and maintain a calm approach. It is important to ensure patient safety by removing potential hazards and providing supervision when required. Family involvement may assist in calming patients and supporting communication. Physical restraints should only be used as a last resort and in accordance with the hospital policy. Again, if you want, you can just pause the video, try to read it, and understand the context. Okay, let me move on to the question here. The question is, according to the memo, when should physical restraints be used? And the options are when patients become confused and require supervision, when family members are unavailable to assist, only as a last resort according to hospital policy, and option D is whenever patients are unable to follow the instructions. Now, this question traps candidates who think confusion equal to restraints. That's clinical instinct, but not policy compliance. Got it? So if you look for option A is confusion is not equal to the restraint, right? Supervision is mentioned as an alternative, so that is wrong. And if you look on option B here, family involvement is supportive, not mandatory, and no link to restraint is given here. And option C, yes, this one shows exact policy language. Ethical plus legal focus is given here, and then safest clinical choice. Option C is the right answer. And let me tell you why option D is also not correct, because this one is overgeneralization. Whenever patients are unable to follow instruction. No, that is overgeneralization and it violates patient rights. Got it? Remember, when policy language appears like last record, in accordance, that option almost always carries exam authority. Now let's move on to another text here. This one is discharge information. So, post-operative care following abdominal surgery. Patients may experience pain and reduced mobility following surgery. Prescribed analgesics should be taken as directed to manage discomfort. Early mobilization is encouraged to reduce the risk of complication such as blood clots and chest infections. Patients should monitor the surgical site for signs of infection, including redness, swelling, discharge, or fever. They are advised to avoid heavy lifting and strenuous activity for at least 6 weeks. Follow-up appointments are essential to assess wound healing and recovery process. Now let's move on to the question here. What instruction is most important to reduce post-operative complications? Option A, taking pain relief medication regularly, monitoring the surgical site for infection, attending follow-up appointments as scheduled, encouraging early mobilization after surgery. And the correct option is option D. Let me tell you why. All four options are correct advice, but part B does not ask which is correct. It asks which prevents complications most directly. So if you take option A, yes, comfort is focused, but it does not prevent complication directly. And option B, detection is given, but reactive and it is not preventive. And option C, this is also very important, but delayed impact. Got it? And option D, encouraging early mobilizations after surgery. Yes, it prevents blood clots, prevents chest infections, and immediate action. So, direct complication prevention, that gives the highest priority. So, in part B, answers fall into four clinical categories: comfort, monitoring, administration, and prevention. Prevention most always beats the others. Got it? So if you remember only one thing from this video, OET reading part B is a priority ranking test, not a reading test. So you need to read like a nurse on shift, a doctor making decision, a professional responsible for safety, not like a student hunting keywords. Got it? So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye-bye.